The hidden truth about health checkups after 70. What your doctor won't tell you. Picture this. You're 75 years old, feeling pretty good about life. You've got your morning coffee routine down to a science. You still beat your neighbor at Saturday morning walks, and your grandkids light up when they see you coming. Then you walk into your doctor's office for what you think is a routine checkup, and suddenly you're being scheduled for tests you never asked for, procedures that sound intimidating than helpful, and screenings that make you wonder if you're sicker than you thought. Here's the thing nobody talks about. The very medical system designed to protect us can sometimes become our biggest threat. And I'm not talking about some conspiracy theory or anti-medicine rant. I'm talking about cold, hard medical facts that even your own doctor might not fully understand. Today, we're going to pull back the curtain on 5 specific health checkups that could be putting life at risk after age 70. These aren't obscure procedures performed in back alley clinics. These are mainstream, widely recommended tests that millions of seniors undergo every year, often without anyone explaining the real risks involved. But before we dive in, let me be crystal clear about something. This isn't about avoiding all medical care or living in denial about your health. This is about making smarter, more informed choices that honor both your body and... Here's what I've learned after years of working with seniors. The same medical approach that saves lives at 50 can destroy quality of life at 75. The medical world operates on a simple principle. Find it early, treat it aggressively, and assume more is always better. This approach has saved countless lives, especially in younger populations. But here's where it gets complicated. Your 75-year-old body isn't your 45-year-old body, and the math of about it this way. When you're 45, you potentially have 40 years ahead of you. A preventive procedure that has a 90% success rate and prevents a disease that might develop in 15 years makes perfect sense. But when you're 75, that same procedure might have a 70% success rate in your age group, and that disease it's preventing might take 20 years to become dangerous. Suddenly, the equation looks very different, yet most doctors in protocols across all age groups. They're following guidelines, staying current with their training, and genuinely trying to help. But those guidelines were often developed based on studies of much younger populations, and they rarely account for the complex reality of aging. Warning sign #1. The colonoscopy dilemma. Let's start with the big one, the colonoscopy. For decades, this procedure has been hailed as the gold standard for preventing colon cancer, and for people, absolutely can be life-saving. But after 70, the picture becomes murkier than most people realize. Here's what happens when you sign up for a colonoscopy at 75. First, there's the prep. If you've been through it, you know it's no joke. You're drinking industrial-strength laxatives that would challenge a 30-year-old system. But at 75, your kidneys don't process these medications the same way. Your body doesn't bounce back from dehydration as quickly. And you're running to the bathroom every 20 minutes. Then comes the procedure itself. You're put under sedation, not just a light drowsiness, but full anesthesia. Your 75-year-old liver processes these drugs differently than it did when you were younger. The medications hang around longer, creating confusion, dizziness, and significantly increasing your risk of falls. And falls, as you know, can be catastrophic at our age. But here's the part that really gets me. Let's say a small polyp, maybe the size of a pea, sounds scary, right? Except here's what they don't always tell you: that polyp might take 10 to 15 years to become dangerous. If you're 75 and in generally good health, there's a very real chance that polyp will never affect your life. But finding it sets off a cascade of fear, additional procedures, biopsies, and follow-up scans that can dominate your remaining years. I think about my friend Margaret, who at 78, hosting Sunday dinners and planning her next cruise. One routine colonoscopy found a tiny polyp. The next thing she knew, she was scheduling surgery, dealing with complications, and spending months in recovery. The polyp they removed, the pathologist said it would likely never have caused problems in her lifetime. This isn't about blaming doctors or dismissing the value of colonoscopies entirely. It's about understanding that after 70, especially if you've had previous symptoms, the risk-benefit calculation changes dramatically. Non-invasive stool tests can catch most concerning issues without putting your body through the trauma of an invasive procedure. Warning sign #2. The full-body scan trap. Nothing sounds more appealing than a machine that can look inside your body and find problems before they become serious. Full-body scans promise exactly that, a comprehensive peek under the hood, so to speak. But for seniors, these scans then they solve. The issue isn't with the technology itself. CT scans and MRIs are incredible tools when used appropriately. The problem is that these machines are so sensitive. They pick up everything, including things that would never hurt you. These are called incidental findings, and they're more common than you might think. Imagine you're 72 years old and decide to get a full-body scan. The technician finds a small spot on your lung, a shadow on your liver, and your kidney. Suddenly, you're not a healthy 72-year-old anymore. You're a patient with 3 potential problems that need investigating. Each of those findings triggers its own cascade of tests. The lung spot needs a biopsy, which requires inserting a needle through your chest wall. The liver shadow needs an MRI with contrast, which can be hard on your kidneys. The kidney irregularity needs a specialist consultation and possibly more invasive testing. Here's the cruel: up to 40% of healthy adults have these kinds of abnormalities that never cause problems. They're just part of the normal variation of human bodies. But once you know about them, the psychological burden is enormous. You go from feeling healthy to feeling like you're walking around with time bombs in your body. I met a gentleman named Robert at a senior center who told me his story. At 76, he felt great and was training for a charity walk. Be safe. The scan found several small nodules in his lungs. The next 2 years of his life were consumed by specialist appointments, biopsies, and monitoring scans. The final diagnosis: all the nodules were benign and would never have caused problems. But the stress and procedures had taken their toll. He never did complete that charity walk. The radiation exposure from these scans is another concern that's rarely discussed. While one scan might not be dangerous, additional testing can add up to significant radiation exposure over time. For someone with potentially decades of life ahead, that's a reasonable risk. For someone in their 70s, the risk-benefit calculation is different. Warning sign #3. The cardiac stress test spiral. Your heart is the engine of your body, so it makes sense that you'd want to keep tabs on it. Cardiac stress tests seem like a logical way to do that. Push your heart a bit. See how it risks. For seniors, these tests can be more misleading than helpful. The fundamental problem is that your 75-year-old heart doesn't respond to stress the same way your 45-year-old heart did. The electrical patterns are different, the blood flow patterns have changed, and the recovery time is naturally longer. When a stress test interprets these age-related changes as abnormal, it can trigger a series of increasingly invasive procedures. Here's how it typically unfolds. Test: either walking on a treadmill or receiving medication that simulates exercise. The test shows some irregularities. Maybe your heart rate doesn't increase as expected, or the electrical patterns look unusual. The next step is often a cardiac catheterization, where they thread a tube through your blood vessels to directly visualize your heart arteries. That catheterization carries real risks, especially for older adults. There's a risk of bleeding, stroke, kidney damage from dye and complications from the procedure itself. And here's the kicker: often, they find exactly what you'd expect to find in a 75-year-old heart. Some mild narrowing of the arteries, a bit of plaque buildup, nothing that's causing symptoms or immediately dangerous. But once they see it, the pressure to do something becomes enormous. Before you know it, you're being scheduled for stent placement or even bypass surgery. These are major procedures with serious risks, especially adults. The recovery time is longer, the complications more frequent, and the overall impact on your quality of life can be profound. I think about Harold, a 74-year-old retired teacher who loved working in his garden. He had no chest pain, no shortness of breath, no limitations on his activities. But during a routine physical, his doctor suggested a stress test just to be thorough. The test showed some minor abnormalities, leading to a catheterization. Weren't causing symptoms. The doctors recommended stent placement. The procedure itself went smoothly, but the recovery didn't. Harold developed complications from the blood thinners, had to be hospitalized for internal bleeding, and spent months getting his strength back. When I last spoke with him, he was doing well, but he told me he wondered if he'd been better off not knowing about those blockages in the first place. The medical literature is increasingly supporting this perspective. Multiple studies have shown that in older adults without symptoms, stress tests don't improve outcomes. They don't prevent heart attacks, they don't extend life, and they often lead to procedures that carry more risk than benefit. Warning sign #4. The prostate cancer screening controversy for men over 70. Few topics generate as much anxiety as prostate cancer. The disease is common, often develops slowly, and the screening test, the PSA blood test, is no-brainer to get tested regularly. But the reality is far more complex. The prostate gland naturally enlarges with age, and PSA levels naturally rise. What's considered normal for a 45-year-old man is very different from what's normal for a 75-year-old. But many screening programs use the same cutoff values across all age groups, leading to a lot of false alarms in older men. Here's where it gets really complicated. Prostate cancer, meaning it grows very slowly and may never cause problems. Studies have shown that many men die with prostate cancer, not from it. The cancer is present, but it's not what ultimately affects their health or lifespan. Yet when a PSA test comes back elevated, the standard protocol is to do a biopsy. Prostate biopsies in older men carry increased risks of infection, bleeding, and urinary problems. And if the biopsy shows cancer, even slow-growing cancer, that psychological impact is enormous. The treatment options, surgery, radiation, hormone therapy, all carry significant side effects that can dramatically impact quality of life. Incontinence, erectile dysfunction, fatigue, and other complications are more common and more severe in older men. Sometimes the treatment causes more problems than the cancer ever would have. I've seen too many men in their 70s and 80s whose lives were turned upside down by prostate cancer treatment. We're never going to hurt them. They went from active, confident men to dealing with embarrassing side effects and diminished quality of life, all in the name of treating a disease that might never have progressed. Warning sign #5. The bone density paradox. Osteoporosis is a real concern as we age, especially for women. Bone density scans, DEXA scans, are commonly recommended to assess fracture risk and guide treatment decisions. But like many medical tests, be problematic for seniors. The issue starts with how the results are interpreted. Bone density tests compare your bones to those of a healthy 30-year-old. By that standard, almost everyone over 70 has abnormal bone density. But having bones that are different from a 30-year-old's doesn't necessarily mean you're at high risk for fractures. More importantly, the medications used to treat osteoporosis, bisphosphonates like Fosamax and Boniva, can have These drugs can cause jaw problems, unusual fractures, and digestive issues. For some seniors, the side effects of the treatment are worse than the condition they're trying to prevent. The real risk factors for fractures in seniors are often more related to falls than to bone density. Poor balance, medication effects, vision problems, and home safety hazards are often bigger threats than slightly thinner bones. Yet we spend enormous amounts of time and money on bone density medication while largely ignoring these more practical risk factors. So where does this leave us? Are we supposed to avoid all medical care and just hope for the best? Absolutely not. But we need to shift from protocol-driven medicine to wisdom-based medicine. Wisdom-based medicine starts with understanding your goals. Are you trying to live as long as possible, regardless of quality of life? Or are you trying to maintain your independence, comfort, and dignity are very different goals, and they lead to very different medical decisions. It means having honest conversations with your doctor about your values, your fears, and your priorities. It means asking tough questions. What happens if we don't do this test? How will the results change my treatment? What are the risks of the procedure itself? Is this test designed for someone my age? It means listening to your body and trusting your instincts. If you're feeling well, maintaining your activities and enjoying life, you might not need as much medical intervention as the system suggests. If you're having symptoms that concern you, then investigation makes sense. The key to navigating healthcare after 70 is being an informed consumer. Don't just accept recommendations because they are standard protocol. Ask questions, seek second opinions, and remember that you have the right to decline any test or procedure. Consider the time horizon of benefit. If a test condition that takes 15 years to become dangerous and you're 75 years old, the math might not work in your favor. Consider the risks of the test itself, not just the condition it's trying to detect. Think about your overall health and life expectancy realistically. If you have multiple chronic conditions that are already limiting your life, it might not make sense to undergo aggressive screening for additional problems. Growing older doesn't mean growing helpless. Every medical recommendation without question. Sometimes the wisest choice is to say no to a test, not because you're giving up on your health, but because you're making an informed decision about what's truly in your best interest. Your 70s and beyond should be about living well, not constantly preparing for illness. You've earned the right to make decisions based on your values, your comfort, and your understanding of what makes life meaningful. The medical system will always be there. You need it, but you don't have to be a passive participant in every protocol it offers. You can be selective, thoughtful, and intentional about your healthcare choices. Remember, the goal isn't to live forever, it's to live well for as long as you can. And sometimes, that means having the courage to say no to tests and procedures that might do more harm than good. Your body, your life, your choice. That's not medical neglect, that's wisdom.